Hello, I am Hannah from Physic Health Consulting and I work as a medical herbalist. So I run a busy online herbal medicine practice and I specialise in menopause and women's health. The main reason for that being that I am rocketing towards menopause myself, so I'm having some interesting times at the moment, and also because probably 3/4 of my patient load these days is women with menopause and various different problems that they're having with that, and herbal medicine can work really well. So just to introduce myself very briefly, I trained as a medical herbalist and qualified in 1999 with a degree in herbal medicine after 4 years training. And I actually became interested in herbal medicine from when I was 14 because I had chronic fatigue syndrome and the doctors at the time were unable to help me. So that started me on a journey into alternative medicine. And I ended up at Middlesex University doing my degree there. So I have been working now for over 20 years. I love my job, I love my herbs, and I would really like to share with you a little bit about why every woman should know about herbal medicine for menopause. So I'm just going to share my screen very quickly, just to help me explain a little bit about what is going on. So here, okay. So I'm going to talk today about herbal medicine versus menopause. Now, even if you are not at menopause age at the moment, experience tells me that if you have any kind of gynae problems, any trouble at all with your cycle, the chances are that that may well continue into your perimenopausal and menopausal years. So even if you think this doesn't relate to you right now, what I would suggest is if you are having problems that you maybe look at trying to resolve them before you reach menopause, and that will just make things a bit more straightforward for you as time goes by. So today I'm going to talk about menopause then and now, because our attitude towards menopause now is very different to how it's been in the past. What the big deal is about menopause, what are the different alternatives that you have available if you're struggling, and whether herbal medicine can help. If you have any questions, please do maybe just email me at the end or get in touch to book a free call, and I'll happily go through that with you. Okay, so what is menopause? In very simple terms, it's the cessation of periods. So it's where you haven't had a period for 12 months. Now, I do know women who haven't had a period for 13 months and then they have another period. So it's kind of difficult to say then whether they're through menopause or not. But in general terms, it's 12 months without a period. But in the lead up to that, we have another phase, which we call perimenopause. And that can last up to about 10 years. So that usually starts when you're in your early 40s. Menopause normally happens around about the age of 50, but obviously it's different for everyone. The oldest lady I know who's been through menopause has been 65, and the youngest I've heard of who's gone through menopause has been in her late teens. So it can really vary between women, but as a rough rule, sort of between 40 and 50. And during that time, the levels of your reproductive hormones fluctuate because different processes need to kind of happen to get to the end. So you'll notice probably that different things happen at different times. The old word for this was climacteric, and it was defined as the complex of endocrine, somatic, and psychic changes occurring at the end of the female reproductive period. So it's very interesting because they're not just talking about the physical stuff, they're talking about the feelings and the spiritual and the emotional side of things as well, as the physical side of it. And we have a similar thing that goes on in men as well. So it's not just women who have these sorts of changes in middle age, men have them as well. I call it menopause, and it's not as obvious as it is in women. So women tend to get the hot flushes, the mood swings, and all the other stuff that we know about. Men, it's a little bit more subtle for them. They tend to get enlarged prostate and heart disease, the two main issues that men get in middle age. So, you know, they need just as much care as we do. They're just not always as receptive to having it, unfortunately. So previously, menopause was seen as a rite of passage. It was a very positive thing. It was what they call the entry into your crone years, which kind of has negative connotations for some people. I always think of witches with crones. But you were then revered for your wisdom and you know, your age and your experience, if you like, and people would go to you for advice, and you'd be very much a valued member of society once you were through menopause. Unfortunately, we live in a bit more of an ageist society these days, so we have a bit more of a negative attitude towards older people, which is a real shame. And it can make a lot of women feel very unsafe and insecure around about that age. Also, in many cases nowadays, menopausal women are not only caring for elderly parents, but they can be caring for children as well. So I'm an older mum. I had my little boy when I was 38. And I couldn't really tell where baby brain stopped and perimenopause began. It all merged one into the other. But it's, you know, it's not an easy time for women, partly because of all the other stuff they have to deal with, as well as their own hormones. These days, we don't have any ritual. There was no celebration. There's no rite of passage. There's nothing to mark the occasion and sort of move us on to that next level. It's all kind of, it's a bit taboo to some people. It's not talked about in a very positive way. And I think we need to change that. There is now a whole industry around menopause. So not only the HRT industry, that's worth about £15 billion per annum, but there's also other menopause services coming into play. So it's become quite a big thing in the last few years. I should also say that I do see loads of patients in my clinic who've gone through menopause years ago, and I say, well, how was it? And they say, I barely noticed it. You know, it's not always the nightmare that it's made out to be. Some women just breeze through it, they barely notice, don't have any problems at all. We never get to hear about those women, but they are out there, and there's quite a few of them out there. So, you know, you don't have to expect it to be a terrible experience, because it isn't for everybody. Okay, but for some unlucky women, you get these sorts of things going on. Basically, anything goes with menopause. You can get any of these sorts of symptoms and more. The most common one being hot flushes. So 8 out of 10 women tend to get those. Mental health problems are quite common as well. So you'll find that sometimes women will suddenly start getting anxiety where they've never had it before, and they can't explain why they've got it. There's been no particular trigger. Anger is another thing. It's something we never really hear about needing treatment for, or people talking about, but suddenly women can become very angry, and it's not being a bit irritable and a bit crabby, it's full-blown murderous rage, some of my patients describe it as. And you know, this is another thing that can go on with menopause. It can affect your performance at work. And it's actually classed as a disability now in workplace legislation. Menopause is classed as a disability because it can impact on your performance for a long period of time, so years in some cases. It can affect your sex life, and 38% of women's partners apparently feel that they don't know how to support their lady through menopause, which is a bit of a shame, but perhaps not very surprising really. So we need to bear in mind that when these sorts of things start happening, two things can happen if you go to your doctor. First of all, some things can get missed. So for example, if you're starting to get heavy bleeding, your doctor might say, well, you are that age, it could be the start of menopause. You could try HRT, or, you know, see how you get on. In actual fact, you need to become aware of what the warning signs are for certain conditions, because yeah, there's every chance it is perimenopause, but at the same time, it could be something else. And these things tend to get missed more around the time of menopause because they are put down to menopause. Also, if you get these sorts of symptoms, the opposite can happen. So they say it's not down to menopause. If you go to the doctor and you say, all of a sudden I've got anxiety, I've got no idea where this has come from, the doctor will go, well, you're probably just under a lot of stress at the moment. Here are some tablets to get you through it. And in actual fact, that's not quite right, because it's the first sign of perimenopause. So you just need to be aware that all this stuff can happen, and make sure you speak to your doctor and ask questions, and do whatever you need to do to make sure that you're getting the right kind of treatment. Okay, so what is upsetting our hormone levels these days? Lots of different things. So menopause has always been a bit of a thing. Our ancestors would have experienced it in different ways, but I think now it's partly that we're talking about it more, but also we do seem to be having quite a lot of problems with menopause for various reasons. So number one, probably the biggest factor I would say is chronic stress. So stress upsets our hormone levels, and that the mechanism that sits behind that is a primeval mechanism, because basically your inner cave woman would not have seen it sensible, quite rightly, to bring a child into the world if it perceives the world as a dangerous place. And when you're under high levels of stress, you go into a stress response, a survival mode, which your inner interprets as being you are living in a dangerous space, you're in a dangerous situation. I'm going to switch off your reproductive mechanisms to make sure that we focus on your survival, and then once the danger is past, then we can look at having babies, but now is not the right time for that. So that is a very clever primeval response that your body has, and it's there for a reason, but we don't always make that association. So we all know that stress can upset our hormone levels, it can upset the menstrual cycle, and it can play havoc with things like hot flushes. And I find that if a woman is hyper stressed, if she's got stuff going on at work, stuff going on at home, maybe, you know, elderly parents to take care of, or, you know, a lot of sickness or bereavement or really hardcore stuff going on, with the best will in the world, there's only so much that the herbs can do to deal with the hot flushes, because the issue is the terrible stress that she's under, and we need to bring more in besides herbs in order to deal with that. The foods that we eat, so some foods contain like chemicals that will upset our hormone levels. Likewise with skincare products that we use, so they contain xenoestrogens, which upset our hormone levels as well. We tend to store those in our fat stores. We tend not to eat quite as well as perhaps we could. We don't exercise, so then we gain weight. That likewise affects our hormone levels. Use of oral contraceptives, implants, or contraceptive injections likewise disrupts the levels. And even in our tap water, so there's estrogen in our tap water, would you believe? That comes from our use of HRT and oral contraceptives, and that's not broken down properly by the body. So when we urinate, basically there's hormones in our urine, and the water treatment can't get that out. So it does affect things that way as well. So I don't want to be kind of all full of doom and gloom, but we just need to be aware that these things can happen, and if we can put measures in place to stop it. So options for treatment if we are struggling with menopause, obviously, first port of call for a lot of women is standard HRT. So you go to your doctor. The doctor may or may not prescribe HRT first off. It really depends on lots of things like your age and your symptoms. But HRT certainly is an option for many women. So women who have a history of estrogen receptive cancers, and sometimes if they have a history of that in their family, even if they haven't had it themselves, are not recommended generally to take HRT, and may not want to take HRT. Now, over the years, there have been various things in the media about links with HRT and cancers of various kinds and strokes and all sorts of stuff. Now, my understanding is that these days HRT is much safer because we have a better understanding of why this was happening and how to stop it happening. So it's generally safer using the combined HRT that we generally have available these days. Also, there are new ways of delivering HRT into the body which are safer as well. However, it's very difficult to get good quality, unbiased information on how safe HRT is. So I've got nothing against HRT at all. I know women who swear by it, they use it for years and they think it's the best thing since sliced bread. I know other women who just can't get on with it for whatever reason. It's a very personal choice, and I don't mind either way what you decide to do. Another option is bioidentical HRT. So that's a little bit more tailored to your individual needs, and my understanding is that that's not actually regulated in the UK. So I have seen women come into my clinic with prescribed bioidentical HRT, and the label on the bottle doesn't even say anything, doesn't even give you the name of the clinic that dispensed it. So it's not regulated. If you're going to go and explore that route, I would just be very mindful to make sure that you thoroughly vet the person prescribing, making sure that they are qualified and experienced enough to do that safely, and that they you know at least what hormones you're getting. It's at least on the label, so that if anything happened, then at least you know what you're taking. Another fairly standard treatment for menopause these days with doctors is antidepressants. So your general two choices with your NHS GP would be HRT or antidepressants. Now, a lot of women say, what do I need antidepressants for? I'm not depressed. I think the thinking is that, like I said, stress really has an impact upon your hormone levels. So they're kind of going in the back door effectively. They're not influencing the hormones directly, but indirectly via your nervous system. And that's kind of what we can do with herbal medicine as well. So if for whatever reason you don't want any of that stuff, other options are over-the-counter herbal remedies. So again, this works really well for some women, and they just strike gold, happen to pick the right remedy for them first off, and they do very well on that. Other women try all kinds of different remedies. They spend hundreds, if not thousands of pounds over the years, never quite finding the right one for them. Also, you have to bear in mind, if you're taking other forms of medication, if you've got other health conditions, that might not be quite the right way for you, because some herbs you've got to be a bit careful with. And if you're just going in, buying it off the shelf without any professional advice, it can sometimes be a little bit risky to do that. A less risky way is to have your herbs prescribed for you specifically by someone like me. So I'll go into that a little bit more later on, but medical herbalists are qualified and trained to make sure that you're getting the right medicine, depending on what else is going on. And also, of course, you can put your own self-care measures in place. So I would certainly recommend that you do this whatever age you are, just to take care of yourself, because we should all be taking care of ourselves, particularly at the moment. But there are lots of things you can do in terms of diet and lifestyle, like these things here. So making sure that you eat properly, making sure that you've got a good balanced diet, you can balance your blood sugar properly and get plenty of good nutrients in. Making sure that you're socially interacting, which has kind of been difficult over the last year or so with COVID, but making sure that you spend time with friends and family and enjoying yourself, and getting that mutual support, giving and getting that mutual support. Obviously, you can use herbs, which I'll talk about in a minute. You can make sure you use clean skincare products, because everything you put on your skin goes in your skin. And like I said, there are lots of chemicals that you don't necessarily know are there going into your body, and they will to some extent upset your hormone levels. So by choosing products which don't contain those chemicals and only contain natural ingredients, you're much less likely to have that aspect going on. Making sure you exercise daily, making sure that you get some good relaxation in daily, which, again, depending on your lifestyle, if you've got kids to look after and family to take care of, and maybe elderly parents and a job, it's not always that straightforward. And this is one reason why I've introduced health coaching into my practice, because I'm a working mum, and I appreciate that it can be very difficult to put these measures in place and start putting yourself first. But it's something that I think at menopause particularly we really need to do. So daily weight bearing exercise, the weight bearing part is important, because your bones will only be as strong as they need to be. And as you know, as our estrogen levels drop, that protective effect upon your bone strength can also drop a little bit. So we need to make sure that we're using our bones and muscles and joints every day. And they say sitting is the new smoking. A lot of us have spent a lot of time sitting recently. So our bodies are designed to move. We're designed to be active. And even if you can just do 30 minutes a day of whatever exercise you enjoy, be it walking, dancing, jogging, yoga, anything where you're bearing your own weight, that will make a big difference. Also, daily relaxation, even if you can only squeeze 5 minutes in a day, it's better than nothing. and your brain will start to rewire itself as you get into this deep relaxed state every day. Chemical-free skincare, if you can also stretch to chemical-free organic foods, even if it's only maybe animal products or your fresh foods, whatever you can manage. I know we're all different, but if you can start sort of moving towards cleaner foods, then that's well worth doing as well. Start including some phytosterols and some probiotics in your diet as well. So probiotic foods are now quite easy to come by in the supermarkets, and phytosterols I'll go on to explain in a minute. If you're sort of looking at the herbs and the other sort of more medical options, personally, I would say to go with the herbs first. And if they don't quite hit the spot for whatever reason, then maybe look at the other forms of medication. Also, be a bit self-aware and reflect on anything that's worrying you or stressing you out, and reevaluate what's important to you, because you know we can get so easily stuck in a rut, and it's not until we stop and take stock of where we're at that we realize that actually some things that we've been doing for years actually don't serve us anymore, and we don't need to do that. There is a better way. Oh, I've gone forward twice there. Let me see. Okay, so phytosterols are, or phytoestrogens, you might have heard. So phytosterols have a weak hormonal effect in the body. So they're not the same as your own homemade hormones or hormones that you would take in HRT, but they have a weak hormonal effect in the body. So some forms of HRT are actually derived from phytosterols. So there's diosgenin, which comes from Mexican wild yam. So people think if they take Mexican wild yam, they're kind of taking a herbal HRT, if you like. That's not actually the case, because there's quite a process that needs to happen to get the constituent in that particular herb to have a hormonal effect on you. And your human body can't do that. This is why it needs to be made into HRT in a lab, in a pharmaceutical factory somewhere. It doesn't work in that way. So you can also get phytosterols from your diet. So there's 8 different kinds of phytosterols. It's kind of complicated. We don't need to go into that necessarily, but you can get quite a bit from your diet as well. So the recommendation is to take 40 grams of flaxseed a day. Sage tea, you might have heard of using for hot flushes. That's a phytosterol. Fermented soya as well also contains phytoestrogens. And this is one reason why we thought that Asian women generally don't have such a problem with menopause as we have over here in the West. Their diet is quite high in fermented soya. I personally wouldn't recommend unfermented or processed soya. So fermented soya is fine, unfermented, not so good. A medical herbalist can also include other herbs in your prescription which contain phytosterols. So it really depends on what you need. Now, women who've had estrogen sensitive cancers, the old thinking when I was training used to be that you shouldn't have herbs that contain phytosterols. But since then, there's been quite a bit of research done, and we found that actually they do have a protective effect because they're sitting on the estrogen receptors and they're stopping the real estrogen from getting in. Nonetheless, some women are understandably still quite nervous about taking herbs with phytosterols when they've got a history of these sorts of cancers. So if that's the case with you, it's not a problem. We can still give other herbs that will work on your hormone balance, which don't contain these things. And we can also work via the nervous system, and we've got lots of different options available. You just need to let me know what you're happy to do. Just to let you know, this is a little picture of my dispensary here. So I've got about 400 different tinctures in there, and I've also got other things as well. So creams, lotions, dried herbs. I can make pessaries, really you name it, whatever form of medicine you can get from your local pharmacy, I can make a herbal version of as well. So what else can herbs do? There is some research into herbal medicine for menopause. Actually, there's enough for the NICE guidelines to say that GPs are allowed to recommend 2 herbs for menopause. I think that's the only condition that doctors are allowed to recommend herbs for. So there's been research into plants like Vitex agnus castus and black cohosh. Nonetheless, it's still kind of important that these herbs are used appropriately. So just because we've got the research to say that they actually work, they still need to be used in a safe and appropriate way. Okay, so that brings me on to working with a medical herbalist, because most people have never even heard of medical herbalists, let alone understand what they do. So medical herbalist is not a protected title. We're not a regulated industry. We're not state regulated. We're self-regulating. So basically, the law says that you could go out tomorrow, set yourself up as a medical herbalist with no training, no experience, no qualifications, no insurance, nothing. You would not be breaking the law. Thankfully, this doesn't happen very often. In fact, I've never heard of a completely unqualified person calling themselves a medical herbalist. Nonetheless, you just, again, need to make sure that the person who is calling themselves a medical herbalist really is, and they can prove that they've done their training and preferably belong to a governing body as well, because if anything were to happen and you had a cause for complaint, for example, which is highly unlikely, then you would be able to go to the governing body and someone will be able to help you with that. Also, just make sure that, you know, they've got a proper qualification, they've got public liability insurance, and ideally check they do things like continuing professional development, so ongoing training and things like that too. The way I work in my practice is that every new patient gets a complete full health assessment. So that basically involves me asking lots of questions, and building up a picture of what's going on and how you've ended up in that situation you're in. If the patient is sat with me in my office, I can look at physical examinations as well, and I might look at things like eyes, just to give me a little bit more of extra insight into what's going on. So once I've got an idea of what's happened, then I can explain that back to you so that you can come to understand how you've come where you are now and what we need to do to put it right. Likewise, if I see anything of concern, so if there's any sort of little red flags or little alarm bells ringing as you're telling me about what's going on, where I think, do you know what, that needs to be looked into a bit more, then I'll discuss that with you and we'll come up with a plan between us. Usually that involves me writing to your GP and explaining what we've found and what we've talked about, and just saying, look, would you mind seeing if we can get some further tests done to look into this? And actually that isn't an unusual thing to happen, and I have sent people to their GP and the GP has then referred them on to hospital for further investigation. So that alone actually can sometimes be life-saving, and this is not something you're going to get from obviously going to a high street shop and picking something up off the shelf. So there's two different ways of taking herbs, and this is on a whole other level to just picking something from your local pharmacy. I also safety check any herbs that I want to prescribe before I prescribe them. So let's just say you've got other underlying health conditions or you're on lots of different other kinds of medication. I will check your medication just to make sure that there are no herbs I shouldn't be giving you. And obviously if there are, I avoid those herbs. So your medicine is always tailor-made to suit you. So you're in charge of your treatment all the time. So let's just say you've got 10 different menopause symptoms happening. I will say, okay, how do you want to prioritize your treatment and where do you want to start? And we build the prescription around that. And then as time goes by and that symptom starts to get better, then we can change the focus of the prescription accordingly. So it's a very kind of empowering way of working. You're always in control, and it's very different to getting an off-the-shelf kind of medication. As well as that, I also offer moral support, because menopause can be a really difficult time for women, and sometimes they feel misunderstood even by their own family and their own partner. So it's nice to have someone that you can offload to, who will listen to you and understand you. And, you know, I'm not a trained counsellor or anything like that, but I can certainly point you in the direction of someone who is, if that's what you need. Also, we look at intensive health coaching as well, because there's usually quite a lot of work to do in terms of nutrition, making sure that you're nourishing your body optimally, making sure you're getting a good night's sleep and plenty of rest and plenty of joy in your life. Because like I said, women tend to put themselves last, and there's not so much room for all this stuff when we really need it to be there. There are three main ways that I work with my patients, and you can just give me a call and I'll explain those to you if you're interested. Okay, so this is how some of my other patients have got on with their treatment. The best one I had was this lady who, bless her, said I'd saved her life, and hadn't realised at the time we first started working together, but she was on the verge of closing her business because her mental health in particular was being so badly affected by her hormone levels that she just felt unable to continue, but she didn't tell me that until after we finished working together. So yeah, in general, women respond very quickly and very profoundly to herbal treatment. So I'm talking about within a couple of weeks, a week or two, they'll usually notice quite a big difference. And like I said, we've got various ways of putting the herbs together, depending on what's going on for you, in order to build that treatment specifically for you. Okay, so that is more or less it from me. It just gives you a bit of an insight into how herbal medicine can work, and offer you an alternative if you are struggling with your menopause, or if you're not at menopause yet and you're already struggling with other gynae issues. So I hope you found that of interest. It is a bit of a big topic, so I haven't been able to cover everything here, but if you are having problems and you would like to have a chat with me and tell me a bit more about what's going on, you're very welcome to get in touch. So you can book a free call online at www.physichealth.uk. I have a Facebook page, which is Physic Health Consulting, or you can just email me as well. So yeah, I hope that's been of interest. I think as many women as possible need to hear about this being an option, because it's a very well kept secret, and I think it could be very helpful. So if you know anyone else who is really struggling with their hormone levels in any sense, please do let them know that I'm here, and send them the link to this video. All right, that is it from me. I will see you again soon. Please do like and follow my social media. That would be really helpful, and I'll see you again soon. Bye.